Welcome to IAP Lab. Our topic for today is restoring hip extension. Hip extension is imperative with gait, running, also just going from a squat position back up to standing. Similar to hip flexion, there can be many limitations of that. It can be simply lack of anterior mobility, lack of posterior mobility of the hip. It can be an SI joint, a nominant issue. But what you want to do is, again, try to isolate where the dysfunction is. Is it a hip extension issue? If so, try some mobilization treatment techniques and then reintegrate that. So what we're going to go over are some ways to assess that extension and then get into the treatment. So, great way to do that to start is working on just assessing it is the Thomas test position. So if the involved leg is your right leg here, you're trying to bring your opposite leg towards your chest, which is going to lock out your lumbar spine, so you're not getting that lumbar motion here. And you want to see, can that hip actually extend past neutral or past the surface they're on? Are they going into an external rotation bias? Is the knee extended? So identifying where is that range of motion limitation. The Thomas test is a great way to assess passive hip extension. Another way to assess how well the hip is extending is with a swing test. You're looking for, is the extension purely coming from the hip, and is the innominate pelvis helping, or is it more of a lumbar dominated motion? So you have them on an elevated surface, and what you're looking for here is, does that hip extend without, again, that excessive low back extension? So you can just do a swing test. You can also assess how they're doing in flexion here, but for our purposes, can they extend that hip without that trunk compensation? Some really poor patterns you'll see here. They'll even explain a little bit of pain in their back. You should feel that innominate glide forward as that hip extends, and you want to kind of test, retest that swingability, the ease of the swing. Great way to work on that extension is with what I call a 3D hip stretch. I also do a little bit of a mobilization with movement. So I have my hand, I'm C-cupping my hand and trying to find the back side of my pelvis or innominate, and I'm just going to add a forward glide on that. But what I'm doing on here is I'm doing that kind of half kneel hip flexor stretch, if we want to call it that. Again, trying not to hinge on your hip or go into lumbar extension, but getting a total body motion here. And we're going to do that three-dimensionally, again with that glide on my hand. So I'm going to lunge forward, glide, glide, lunge diagonally, glide. You might get adductor, you might get front of the hip, even feel a little bit of pressure in that kind of PSI area, and then go sideways as well, keeping my hip forward. So I'm getting three-dimensional hip extension with a little bit of innominate SIJ self-correction. So after the 3D hip stretch, which is more of a mobilization or a stretch, we're going to do more of a motor control thing. I call this a half kneel overhead press. But you're in that same half kneel position. What you're going to work on here is a hip hinge, working on that hip flexion, but then working on the motor control of hip extension. You can use a barbell here. We just have like a water resistant tube here. The weight can be pretty light to start, but you're going to have arm and extension, upright trunk, trying not to go into that lagging on the anterior hip. From there, you're going to do a hip hinge, flat back, butt towards your heels, bringing that bar down, and then you're going to work on glute control with an anterior stretch. So you're getting glute facilitation with anterior elongation, hip, hip, hip hinge, and drive. Hip hinge, and drive. So, great way to work on motor control of hip extension. The 3D hip stretch, great way to work on self-mobilization of it. Again, first, is the isolated dysfunction hip extension? If it is, these are two great ways to help integrate it and then take it into performance such as running, squatting, whatever it would